Hello again, and today we're once again in sunny, warm South City, and we are on election day, November 3rd, and basically decided to do another broadcast because it's election day and it's weird and basically another values and control thing. Dealing with what is the world going to look like after today? Whether Trump wins or Trump loses, it's going to be a significant change, at least in terms of like what our focus is. Um, the primary situation that's going on is we have a dramatic shift in voter enthusiasm from 2008 to 2012 to 2016, where it drops, and then a dramatic shift back up in 2020, where they're estimating over 50, probably 152 million votes. To put that in perspective, the one who wins, whether it's Trump or Joe Biden, is going to have over 70 million votes, the highest total of all time. Um, for either of these two men to get 70 million votes says a lot about really what's going on in our country. I don't think it's all bad, but some of it's bad in the sense that the country really, if you overall, there's no way 50% of the country has confidence in either two of these people. It's well understood that, and I think that um, it's clear Donald Trump is running on the idea of him, Trumpism, judges, and a basic right leaning political approach to social and economic problems. You know, he's going to cut taxes, he's going to do basic Republican things. Whereas Joe Biden and Kamala Harris, the balance of their message is COVID-19 is a serious threat. Donald Trump caused all the deaths, and he's also a racist. And I think that's really the fundamental debate that's occurring now. And to me, that's kind of striking that Joe Biden may win 72 X million votes. And I think Joe Biden's going to win. There are various reasons why I think he's going to win. But he's winning based off of something that on its face is fundamentally false. The idea that there has been no example of a plan that Donald Trump was supposed to implement that would have saved 80, 90 million percent of the deaths. You had Dr. Gupta, one of the Dr. Guptas, the MSNBC Dr. Gupta, claimed that 70 to 80% of the deaths could have been stopped if Donald Trump had everyone wear a mask in February. Except Dr. Fauci and the entire federal health care establishment, infectious disease, CDC, Surgeon General said don't wear masks. And that not just that they're not necessary, but that they're probably going to hurt. So they didn't change that position until all at one time they changed it about April 3rd. So Dr. Gupta from MSNBC just creates this completely false statement that Donald Trump somehow was supposed to know to tell everyone to wear masks. And his case was he should have produced masks for 331 million people instead of having them wear these cloth things that don't work. Gupta, in the process of trying to demonize Donald Trump, has effectively annihilated most of the case for masks, which was all of the facial coverings were going to offer some kind of significant help. But if you see, they claim that all this data shows that masks work, but they don't say they're reducing the spread or the positives in it. They're trying to compare the rate of spread between high population areas, which pretty much every big city has a mask mandate, and then these low population areas that got the virus later and have increased rates of infection, which often isn't even true. But I'm looking at this case and I'm saying that's not a scientific case. That's a correlation-based case that's focused on taking a particular point in time without registering any variables and saying, well, gee, this one place that had 26,000 cases, now they got 62,000 cases. There's another place that had 13 cases, and now they have 130 cases, therefore masks work. That's a stupid, stupid case to make. That's a stupid case to make. You know, and it's kind of scary to me that you have people in positions of power in government who are making such a absurd case. And I think that you get yourself into problems because you're actually creating a precedent for flawed correlation-based observations. Like I said, California is a perfect example. June 19th, mask mandate. Their 7-day RDL, their 7-day rolling average for fatalities was 60. By July 25th, it's 130, like 118. By August 15th, it's 130. And even when it came down, when the deaths came down for the rest of the country, it hasn't. It even in the September hadn't dropped below 60. So if 60 was the metric that was too high, after the mask mandate there was no drop. And the case that they're making is Donald Trump has killed all these people, and the only real measure they can point to, because testing doesn't stop people from dying of COVID-19. And the PCR testing may actually register a virus that's 2 months ago. Now Texas is finding some of the people who died tested positive months before the illness that killed them set in. And so you have Florida and DeSantis, same situation. And you have Texas and Florida now looking into, well, are these actual COVID deaths or is these died with COVID at some time? This is a problem. I think that Harris and Biden do not have the right to be presidents of the United States because of the fact that their entire campaign is predicated on a lie, which is Donald Trump caused COVID-19 deaths to be too high. Did Donald Trump do what he needed to do? No. Does Donald Trump understand the data in a way that's remotely intelligible? No. Could Donald Trump have saved some more people? Sure. But so could have Cuomo. So could have Kamala Harris. So could have Sheila Jackson Lee. What did the Black Caucus do? What was their bill to protect black seniors and seniors overall from the extremely high rates of fatalities in April and May? Nothing. You know, wearing a mask, there's no evidence that it's going to stop anything at any rate. It's a supposition that was clearly not assumed on March because if that was considered to be so effective, we've had influenza for I don't know how many hundreds of years or whatever. You know, you talk about the influenza outbreak of 1918, you can't compare it because back then it was younger people dying. And I'll say this flat out. I'm going to say this. I contend that COVID-19 is not more deadly than the flu. Not based off of the hype or the Trump hype, but based off the CDC. The CDC says that COVID-19 is less deadly to younger people than the flu. So I looked up the numbers, and according to the CDC, 468 people under 24 have died of COVID-19. Of course, every death's tragic, whatever. You say that crap, but you don't say that crap when 35 people get shot in one day in Chicago, The anti-MAGA coalition does not care about the deaths of people they don't know. Stop lying to me. 468 deaths under 24. That's what the CDC figure says. Okay? There are more people who've died of flu from that age. We know that, okay? So the problem comes in, okay, well, it's much deadlier to seniors. Well, that means that the virus in and of itself, by itself, to me, I think it's questionable as to the case that it's more deadly. Because I think that if a virus, you say it up in July had only killed 121 people, according to the CDC, and I don't know what exactly the NIH does with Fauci. He just gets up there and says, "Shut down the bars, shut down the football games." I think his contribution is utterly worthless. But I will say this: the CDC often gives you clues as to really what's going on, which is this is a disease that relates directly to the fact that we have a serious problem in this country with senior care and elderly care. And we have a problem with natural immunity and progressive immunity. And if the disease is less deadly to people or negligibly more deadly to people going up to 25 years of age and less deadly to younger people, I say it's less deadly. If 460, they had the statistic, black people die more of it, but they never break the data down. If black men knew how few the median black age, according to Coleman Hughes, and I do need to check this, and I've seen it several times, is about 27. There haven't been anywhere close to 1,000 black men, 27, who've died of COVID. And yet millions of black men have seen their economics fall. Do the math.